Hello everybody, this is Doctor M T Ahmad from the London Aesthetics and Regenerative Centre here in London, and I would like to talk today about slimming the face. We've had a lot of inquiries, a lot of people are asking, how do I make a fat face slimmer, and particularly how do I make my jawline slimmer. Now that really depends on the age of the patient, depending on the type of treatments that we can offer. There are different treatments available for slimming the face. These include the use of Botox, the use of fillers for contouring, the use of small PDO monothreads for rejuvenating the skin, the use of larger PDO coil threads for lifting and pulling back, and also the use of HIFU for contracting the skin, reducing the fat. What we tend to find in younger people is that they tend to have, a lot of people have grinding of the teeth and they have an enlarged masseter muscle here. This gives a sort of squarish appearance and it causes this area to protrude out. So by just a simple bit of Botox here to shrink the masseter, and then along the neckline up here, which is known as the Nefertiti lift, after the Egyptian pharaoh Nefertiti, who was famous for a beautiful long neck, can do the trick. In some people who have a bit more, what we can do is do a bit of a HIFU treatment, and what HIFU does is it tightens the skin in deeper levels at 4.5 mm, at 3 mm, at 1.5 mm, and gives a tightening 30% instantly and 70% over the next 3 months. In addition to that, if they've got the enlarged masseter muscle, we can then do a bit of Botox. Some people that have a lot of fat up here, we can actually work on doing some fat reduction as well. So we can do a fat reducing HIFU, we can do fat dissolving injections, followed by HIFU for skin tightening, or mini PDO threads for rejuvenating and tightening the skin. For those who are a bit older, the skin is a bit more mature and a bit more, and a bit more relaxed, they tend to require a lift, a PDO coil cannula lift up here and pull backwards to lift this back, and that helps with taking the fullness away from here and bringing it back here. The important thing to realize is that when we are slimming the face, what we're wanting to do is change the altered perception. So we may not necessarily need to change the structure, but we want to make sure that this is more prominent and this is more defined, so that the distance from here to here, from your jawline to your cheekbone, is more in. And there's two ways of achieving that: bringing this out and bringing this in. I've discussed the ways that we can bring this in, and what we also can then do is use some dermal filler to just enhance this area up here, bring this out, and we can even use some dermal filler up here just to contour here to create a bit of contouring and bringing that in. So what that does is that gives the illusion of a slimmer face. It's a bit more prominent up here, it's a bit more inside, and that takes it away. The only time where a bit more work is involved is if you've got really big puffy cheeks, and then what we do is we have different treatments available for shrinking the cheek area. So in summary, to slim the face, what we have to do is enhance the upper area, shrink the lower area, and change the ratio and proportion to the upper to the lower area. To enhance this area, we would use possibly dermal fillers for the cheek or nano-fat grafting. To shrink this area, we can use Botox, we can use HIFU, we can use threads, or we can use some dermal fillers for shaping. By combining these techniques, depending on which age you are, we are able to offer you slimming of the jawline and slimming of the face. Those that have been thinking about this are still trying to maintain the natural ratio of the face, which is 1/3 upper face, 1/3 mid face, and 1/3 lower face. So when we are contouring, we will sometimes then enhance this area and this area here as well. So by taking that in and bringing the chin area and this anterior jaw area forward, we create a slimmer look. And the human brain naturally thinks that beauty is 1/3, 1/3, and 1/3, and that's what we're trying to take you towards. Thank you very much.